that wish that was there, but at the same time, we did not want really to be seen as we are encouraging herbal medicine use during COVID, because in Malawi there were a lot of these medicines being used. So we were actually very cautious. What we wanted actually to do is to use those claimed medicines to find out whether they were efficacious. But we did not come up with some sort of a drug, herbal drug for use in COVID. Yeah. But we know we had our colleagues, we have our international partners who had developed something that was used for COVID.
The AC approach by the World Bank, it's a good idea. During the involvement, like being part of the team, I've seen some students from across Africa, coming over to Malawi, learning different kind of disciplines within public health, and some of them herbal medicine, and for which, as a university, without this platform, I wouldn't see many of these foreign students coming over. But at the same time, as part of capacity building, apart from myself, there have been a number of staff who have benefited from this project.
My topic of research, the title is Awareness, Attitudes and Beliefs of Our Women and also Healthcare Providers towards Pain Management in Labor. So my field of interest was fetal and maternal medicine, which mostly is obstetrics. Okay, because I've seen that that's one other area that we are not doing so good. Our maternal mortality rate is still very high. Of course, we've reduced a bit from the 439. It's a change, but I feel like we can do better.
I've benefited from ACEPHEM, mostly in research, because my program is mainly concentrating on research. And I wished my friends also could benefit from such exchange visits.
The support was incredibly amazing, and from the financial support of the sponsorship of the study, ACEPHEM funded me to do the studies, so they covered my tuition as well as the research costs. And then the experience from the professional academics was also great, from Professor Lampiao and from the tutors in the program, and trainings and exchange research materials, and even the interaction between student to student was very great, and everyone was just being supportive of each other through the time of my studies. So my project, I was investigating the antimicrobial activities of selected local medicinal herbs against Streptococcus pneumoniae. So Streptococcus pneumoniae causes invasive pneumococcal disease, which is a very great burden in Malawi and other low and middle income settings. We have interventions to cater for this pneumococcal disease. For example, we have antibiotics as well as vaccinations that are widely used in our setting. These are effective, yes. However, they are faced with limitations. For example, antibiotics are faced with antibiotic resistance. If you talk of vaccines, Streptococcus pneumoniae has over 90 serotypes, but the vaccines that are available only cover a limited number of the serotypes. That's why I felt the gap and the necessity to look for other alternatives, which is, in my case, was herbal medicine, to say, can we use herbal medicine to cover and cater for the challenges that we have in the interventions for Streptococcus pneumoniae.